Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello again, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and when it comes to eating disorders, most people assume it's all about food. But I think the truth runs a lot deeper than that. On this episode of Doc Talk, we're joined by Abby Lambert, a registered dietitian, and Riley Goodwin, who is a physician assistant certified, to take a closer look at the complexities of eating disorders, from early signs to recovery strategies and how treatment can still happen even when the resources are limited. So thank you both for coming in here and doing this, you guys.
Yeah,
I really appreciate it.
us.
Yeah, absolutely. So Abby, you're East River. We'll just get that out of the way right now. But you're here now. Exactly. You're fine. So did you grow up out in Mitchell or just East River or where are you from?
Yeah. So I split. Most of my time was in East River,
Okay.
and so I spent the bulk of my childhood in Mitchell.
Oh,
Yes,
awesome! Yeah.
yes. So close to the river.
Corn Palace,
right?
born
Yes,
and raised,
world's
baby.
only Corn Palace. Have to say that. You have to stop at least once.
Do you get tired of explaining that to people though?
No,
when
because
they ask about it?
It's what we're known for.
It's just
so
in your blood.
It's in my blood. Corn is in my blood, and so yes, I brought that now over to my experience here, West River.
So what got you into the field that you're in right now?
Yeah, that's a great question. So I really was interested in eating disorders much before even I went to school to become a registered dietitian. Within there, I had quite a few personal experiences close to me that suffered from disordered eating and eating disorders. And I myself went through a gluten intolerance diagnosis, which actually spurred my interest in nutrition and how that's like a restriction of a food group, but how that can lead into disordered eating and ultimately an eating disorder. And so that's really where my interest came in. And then it was just fueled by seeing the impact that it has on the majority of the United States and Americans. And so I knew I wanted to work with this population and help them along with their health and create that healthy and positive relationship with food in their bodies.
So it's something that you're pretty passionate about.
I would say
it
yes,
sounds like it for sure.
absolutely.
Just the way you were able to go through that whole thing. It sounds. So Riley, you're West River, Best River. But how did you get involved in this? Do you have this in your family? Do you have medicine in your family? Do you have people that grew up in this field?
Actually, no.
Really?
A lot of my interest for becoming a part of healthcare was based off of family members' illnesses. And so that's also part of a personal experience that got me into this eating disorder team with Monument Health. And so just throughout my formative years, just made me want to be a part of this team and help our community. And, it's a underserved area, eating disorders within our community.
Is it really?
It is.
It is, absolutely.
It seems like we hear a lot about it, but I guess I'm kind of surprised by that, honestly.
Yes.
Well, let's get into it. Let's start right with the big one. Why are eating disorders not just about food? And what should people really understand about the emotional and mental parts of this?
So I think there's so much to think about with eating disorders, and it's so much more than food. I am a very visual person, and so I think about a Venn diagram type of situation. And so, of course, food is a part of it. We need food to nourish our bodies. Another big part of that is our body image. And so I think about that overlapping, the relationship between food and our body image. And then I think there's about 8 other circles to think about. You have to think about society's impact on our relationship with food and our body image. You have to think about previous traumas that impact that relationship. You have to think about social determinants of health. Are you able to afford food that can nourish your body? Previous anxiety, depression, can play a role in that as well.
Yeah, you have all of these different parts, like Riley said, coming together. It's a psychosocial and physical condition. And so we have all those avenues of health coming together. And one thing that people don't realize about eating disorders as well is that there is that medical and mental health side of it too. But in addition to that, a lot of times when we think about that mental health, there can be things that are so out of our control. And so we think about what an in our life can we have a sense of control about? And what that is, one of them is food.
Yeah.
Whether it's the restriction or it's the consumption of it for comfort, either one of those really revolves around that. And so that's why there's so many different parts, and it's so complex when it comes to treating this illness.
Well, you guys must come across a lot of misconceptions too. What are some of like the common myths you guys hear when it comes to this?
Yeah, so the common myths and the two big ones that I commonly see that have a really big impact on the clients that we see and the patients we see is actually that eating disorders are rare. A lot of times I get told, well, I don't see a lot of eating disorders in my clinic. And my response is, well, they're there, we're just missing them. Mm-hmm. And essentially, we know through research that 1 in 10 Americans are going to have an eating disorder during their lifetime. That's over 77,000 South Dakotans that will be diagnosed. And in fact, that number is most likely much larger because research estimates the majority of Americans suffer from disordered eating, which can therefore lead to an eating disorder within there. And 70% of individuals with an eating disorder will not seek treatment or a diagnosis during their lifetime.
Now, what is you said a disorder with
Yes.
eating, and what are the difference?
Yeah, that's a great question. So with disordered eating, I always say that an individual with eating disorder has disordered eating, but not everyone with disordered eating has an eating disorder. So much like Riley said with the Venn diagram, they share a lot of the same characteristics, such as dieting, eliminating food groups, or reducing food groups, compensatory behaviors such as using diuretics, laxatives, excessive physical activity as well, concern about body image too, potentially intentional vomiting to supplement based on the calories that have been consumed, anxiety, depression, some of those same things. But what we find when it moves over into an eating disorder is, of course, we have criteria that we must meet. And usually what it means too is that these symptoms are interfering with day-to-day life with an individual, and we're starting to see more of those medical and mental complications that often come from it. Yes. Yep.
Okay.
So disordered eating.
That was a
Yes.
great explanation for that.
Proceeds.
You said, were there any myths or things that bother you too, Riley, that you come across?
There's one that I think of. I also think of the rare stigma or stereotype out there. But one that I hear is that eating disorders are a choice. Eating disorders are not a choice. As I was talking about earlier, there's so many factors that play a role into eating disorders, and it is everything but a choice.
That is something I don't think a lot of people think about. I agree. I think I would have said, well, just stop. Just don't overeat. Don't undereat. Don't, right? Is there the warning signs that you guys look for with this? What are some of them that you notice when they come into your clinic?
Sure. So as a primary care provider, I definitely look for any changes in weight. In adolescents, if there's any changes in their growth charts. Fatigue, dizziness are very common signs, symptoms as well. Cold intolerance. And one that I really think that gets missed with eating disorders is actually GI symptoms. And so constipation being a huge one, feeling nauseous, vomiting, stomach pain.
You mentioned like one of the first things you said is a difference in weight.
Yes.
It can either be a weight gain or a weight loss, I'm assuming, correct?
It can be both, yes.
Are there people that can maintain a pretty normal weight and still have what you guys consider an eating disorder?
Absolutely.
Really?
So most individuals with eating disorders are not underweight.
Mm-hmm. Yes, about only 6% of individuals with eating disorders are clinically diagnosed as underweight. The vast majority are living in an average to a larger size body, and that's not just our conditions where there's overconsumption. It's actually our restrictive eating disorders. That's more common, that we're not seeing a big change in weight, but we're seeing all of these other symptoms that Riley just talked about, in addition to changes within diet and physical activity.
Now, explain a little bit about a restrictive eating disorder.
Mm-hmm. Yes. So the difference between that and binge eating disorder,
Yes.
like where it's overconsumption. Yeah.
Yes.
So one of the unique things that's also not known about binge eating disorder is binge eating often comes from a period of restriction too. So many eating disorders, actually I would say all of them, have a restriction component to it. It's not just about the overconsumption within there. So a lot of times when we're talking about the more typical restrictions, such as anorexia nervosa or bulimia nervosa, we're talking about these individuals are restricting their intake, so they're eating less than what they need, and they're not doing anything to increase their intake within there. So they're not eating more food after that, where what we see with binge eating is oftentimes it is overconsumption of needs within there. But oftentimes what comes before is inconsistent eating. So individuals will go anywhere from like 6 to 12 hours without eating. And then of course they have this period where the body goes, I'm so hungry. And so nature takes over, and actually it feels like your eating's out of control and you can't stop. And so it's where nature plus mental health come together, that physical and mental health. I always say the physical hunger plus the emotional hunger comes together and creates the perfect storm.
Oh my God, that just seems like an unbelievable struggle to have that you guys must deal with quite a bit. Well, you guys obviously work together. You guys have a team approach to this, right? So how do you both collaborate with the other professionals that you work with, or together? How does it work with you two?
Sure. So we definitely will call each other or message each other very frequently to, share information about patients and how we'll collaborate to how we're going to help this patient with their journey with their eating disorder. From a primary care perspective, I definitely focus more on, the vital signs as well as labs that can change with disordered eating. And then collaborating with the registered dietitian, where are they at with their, nutrition plan, as well as with therapists, where are they at with their emotional health.
So you're bringing it, you have a third type that comes in, a third profession that can come into this as well.
Yes.
So you guys, it's you two as a team in general, but then you'll bring in somebody like a therapist that I suppose also could really, if you kind of have that three-pronged approach, that seems to be the most effective.
Yes.
Would that be true?
Yes. And in fact, it's the evidence-based approach to treating eating disorders. At the core group, of course, there can be more individuals along, which helps lighten the load. That's what I always say, right? Teamwork helps lighten the load. And that's absolutely true when it comes to eating disorders too. But the three main individuals at the core group needs to be primary care, who's going to focus on the medical, registered dietitian, which of course focuses on nutrition and dietetics, and then you have the psychological side come in, whether that's a therapist, counselor, or psychologist, and then we can always have other members in there, such as a psychiatrist or psychiatry provider to do medication management. Maybe perhaps they have a chronic disease, so they're also seeing like endocrinology, perhaps for that, and so all of these other members will come in. Case management is always helpful in kind of managing all of these other appointments that are coming up. I think one of the most important parts in addition to building a team is making sure you have members who are eating disorder informed too, because we say in the field of eating disorders when we get into it that every profession has to do a little bit of unlearning and relearning, because it can be so different than what we're taught in school. Riley and I were just talking about this, that I think you said you got three slides of education, and I received one lecture. And so the bulk of the work that we've been doing is actually outside of our traditional schooling within there to learn more about this.
Now, I'm trying to put myself into position of somebody that might be struggling with an eating disorder right now, and hearing what you guys have just mentioned about the clinical side, the diet side, the mental side. And to some people that might feel a little intimidating. Like, oh my goodness, I just want to talk to one person, and I don't know what the next steps are going to be. How do you guys work with that? How do you guys deal with that?
I think the most important thing is to be compassionate and, non-judgmental. I have so many patients that come to see me and say that they were terrified to come and talk with me. And I think that is because there's such a stigma related to eating disorders. And so just meeting patients with where they're at and being open, how can we help you as you recover? What are your goals? What can we do to help you heal? And, educating on the different aspects of the team and each of our roles to help each person.
I suppose sometimes, too, if you have a patient that comes in for something else, and you notice that, well, wait a minute, there might be an eating disorder involved in this. That's got to be hard to approach. How do you guys do that?
I definitely approach it with very open-ended questions. And so I will say, I will start the conversation in general, tell me about your diet. And then as they're talking about, their nutrition, I will say, do you feel comfortable if we talk about in a little bit more detail what behaviors with your eating that you've mentioned today And so just posing the question if they're comfortable talking about more in depth some of the, different behaviors.
Do you have the same thing?
Yeah, I use very similar, so open-ended questions. Of course, I'm looking for those red flags that we discussed before, a little bit more, though, towards the nutrition side, absolutely.
Right.
Though. So are we restricting certain food groups? Are we making sure we're getting enough for our body? Are we in a pretty big calorie deficit within there? I also ask questions like, what do you feel like your relationship is with food and body? Like, how do you feel that is? And what would you like it to be? And I don't think I've had any person step in my office that said, I want a poor relationship with food and body, right? I really take that approach and talking about what they're currently doing now, is that benefiting them? Is that getting them towards their goal? So a lot of times too, depending on severity, that conversation might look a little bit different because of course, if you have greater concerns, it's going to be a more serious conversation that you're having, but opening it up like Riley and establishing that rapport, that's the biggest thing, that the patient leaves feeling listened because it's their autonomy to decide what they want to do with their healthcare. We're just here to help guide and support them through it within that process.
Are there types of eating disorders? I'm assuming there are. We've been focusing quite a bit on eating disorders that affect people mentally, but I suppose all of them really do. But are there just physical eating disorders that you guys have to deal with that you as a dietitian can help with when it comes to people that say like have cancer and they just can't they can't eat like they should, but they want to eat like better? Is that still considered a disorder in that sense?
So with an eating disorder, of course, too, Riley would have more specifics because I can't provide that diagnosis. But a lot of times we do see that mental component within there. We can have malnutrition in the form of like cancer and things like that with other biological things coming on that may not be connected to the medical or the mental health, there within there. So I do help with those. And that's something, of course, that is a similar approach to what we do with eating disorders. It's just not quite so much emphasis placed on that relationship with food and body within there. Yes. Riley, would you have anything to add to that?
Yeah, I would agree. I wouldn't consider it a form of eating disorder because I would say it would be more malnutrition related to another diagnosis. You don't have that piece of body image, which is commonly seen with eating disorders.
Now, I think I know the answer to this question from both of you. How do you guys feel about social media when it comes to eating disorders and body dysmorphia and things like that? I mean, it's had to have been a problem, right, over the years since it's become as prevalent as it has. Have you noticed that in your practice that plays a big part of this too?
Yes, I would definitely say that it poses a challenge because I feel like society tells people what we should look like, and that has definitely introduced and opened the door for people to feel uncomfortable with what their body looks like. So it definitely is challenging.
Yeah, it opens up the door to a lot of comparison. And also when we even look at things like bullying or being around those different influences, instead of leaving it in a very social environment, it follows you home. And it's always at your fingertips. And so what we see is that continued exposure to that, and we have research that backs this up, actually does have a big impact on mental health in total. And when we think of eating disorders and the fact that they are mental health diagnoses with medical complications, like that poses a real threat and increases the risk to that. And that's what study shows us, that nowadays individuals who are growing up and children, when they're exposed to that social media, they do notice those increases in anxiety and depression in comparison, because how can it not be when you're constantly watching people on social media?
That's so true. We talked a little bit, you touched a little bit earlier on about, it is hard to get healthy food affordably. I think that's been an issue for quite a while when the foods that we know we shouldn't be eating are readily available and they're super cheap, and we have 14 apps on our phone that give us $1 deal on whatever every day, right? How do you guys navigate through that when you know that some people might be low income, might be struggling with the ability just to buy groceries for their family? That also has to kind of play into some of this too, which can lead to that disorder as well, can't it?
Sure. Something that I typically focus on is making sure that you're getting each food group. And if that's affordable for you and you're able to get each food group, that is a great goal.
Yeah.
Okay.
Yeah. Within there too, I think it goes back to social determinants like Riley was talking about. In fact, we do see higher eating disorder rates too in individuals who have experienced food insecurity, because if we think about it, there's that unintentional restriction of intake, and it can also cause binge eating too then when food is available. And so we see those things come together to influence eating disorders earlier on too. I think the big thing too, this brings up the question of how do we talk about food within our healthcare setting and weight too, in terms of like individuals may not have access to those types of foods, especially living in more rural South Dakota. In fact, most of South Dakota is rural, right? We live in Rapid City, but we talk about all the time, we're still treating rural and even frontier medicine per se with that. So being open and honest with clients, but also meeting them where they're at and not talking about foods as good and bad, right? If someone's struggling to even get food on the table, or right at that point, what's important is that they're eating, regardless of like what that is. Now, if we can get all the food groups, like Riley said, absolutely, that's what we want to advocate for too. But first and foremost, we want to make sure they're fed.
Got it. Well, it can be, starting this journey obviously can be pretty overwhelming for people. And I think what you guys have kind of laid out, hopefully, will put some minds at ease that there is help here in Rapid City specifically, that Monument's a great place to go to start this, and with you two as well. So what if somebody hears this podcast and they're like, okay, I want to make a phone call, where do they start?
So I would say start with whatever you feel comfortable with. If that is a family or a friend, your primary care provider, whoever you feel comfortable sharing your journey with. But of course, you can always reach out to primary care, registered dietitian. It's just starting somewhere.
Can somebody go to urgent care about this if they have nowhere else to start and they're thinking, I can just go in and say, hey, I know I have this deal. I'd like to get help, and they can go into there and get it if they don't have a primary care doctor. Or
they
anybody
can
like
get
that.
a
Okay.
referral.
Yeah, there we
Absolutely.
go.
Primary care
perfect.
now, especially within the Flormann Street clinic, is a great place to start, especially if you don't have a primary care provider to begin with, because they can get you connected to a primary care provider within our system and also send in those referrals, though, to get you started down that road.
Okay.
So that's a really great resource we have within there. And within Monument Health, too, just to add to the sources, yes, there's, of course, Riley and I who work with individuals with eating disorders, but we also have a steering team that's a group of professionals working to increase their knowledge on eating disorders, and then also increase the confidence and tools for other professionals, healthcare professionals, both within Monument Health, but also our community partners, so that they feel comfortable being able to assess and then also create those referrals and treatment plans for those individuals with
Do
eating
you guys
disorders.
work with it? Is your team small, big? Is it expanding? What are you guys hoping for?
Yeah,
Hoping it expands.
so
of
Yes,
right
course.
now-
hoping to expand.
Yeah, so we're a group of professionals that come together. So we all practice individually. So we don't necessarily have a formal team where you're going to go see these certain providers. But what we work together to do is to increase knowledge, but then also we'll refer to one another as well. But we also work with other community providers out in the community too.
Yeah.
So a lot of therapists, other primary care providers too, psychiatric providers as well. And really what we want to do though is increase that knowledge and that toolbox of providers to be able to support these clients within there and improve confidence within there. And one of the things that we really focused on, especially these last few years, is the word education. So in fact, for even our Monument Health providers, we're providing a full day education for them and some of our community partners when it comes to eating disorders, just to start building that basic foundation and giving them some of those tools, adding tools to the toolbox, as I like to say, into their bag that they can draw from, but then that they also feel like they have a team to go to that has more experience in this area and they can consult with so they can better serve these clients.
Well, one thing I've noticed with you two as well, and I'll call this out every time we've done 140 some episodes of this podcast, and what I love to see from the professionals that I talk to is your genuine compassion for this, that your desire to make sure that you are helping. And too often in the medical field in the past, it was just get you in, get you out. Nobody felt listened to anymore. And I think that's one of the most important things that you guys do right now is make people, you said it earlier, just feel heard. They just want to know that somebody listened to me and now I might be able to beat this. I might be able to take the steps that I need. So thank you guys both for picking this field, coming out to the better half of the state too, Abby. We appreciate that. Addie Lambert, registered dietitian, and Riley Goodwin, who is a physician assistant certified at Monument Health, talking about eating disorders. You guys can come back anytime and we'll do it again, okay? This has been fun. I appreciate it.
Thank you.
Thank you.